Thank you for sticking around. This is the Now Morning Show, your Wednesday edition. And ahead of World Sight Day tomorrow, it is fitting that we are joined by Dr. Ronnie Bhola. He is the CEO and Chief Surgeon at the Trinidad Eye Hospital and the recipient of the Hummingbird Gold Medal this year. So he joins us on the Now Morning Show as we explore the theme, Love Your Eyes, Kids. Good morning and welcome, Dr. Bhola.
Thank you for having me. It's a real pleasure to be here.
Well, let me say, first of all, thank you for gracing us with your presence and your medal. Oh. Congratulations, because as we were talking before, all of the recipients that have visited the set so far have been keeping it at home for some reason. Oh. So I imagine the distinguished pleasure and honor must have been significant. What was it like to receive that honor, sir?
Well, first off, I was really taken aback by receiving the medal. In all the things that I have received in my life, this to me is the biggest and best one. It is such a joy to have done so much over the years and then to be recognized by nationally for it. And, you know, it speaks volumes for the organization. So I felt really proud.
Speaking of years, dedicating your life to that sort of service, how many years are we looking at? Because I believe in terms of your current status, we are looking at consultancy. But as a practice, even as the chairman of the board, how many years have you been in the world of eye care?
So I started my career in 1992 in medicine. Well, I finished my training at that time. And by about 1999, I went to England for about 10 years and really did most of my ophthalmic training. Mm-hmm. And then I came back home in about 2016. And from about 2006 mm-hmm. to now, I've been working in the eye care business.
Now, at some point, the formation of the Trinidad Eye Hospital would have happened, and you dedicated quite a number of years to that as well. So tell us a little bit as to what established or inspired the establishment of the Trinidad and Tobago Eye Hospital.
Well, I really wanted to try and have an impact in the eye care part of Trinidad and Tobago's development. So I wanted a vehicle to do that. And we formed the Trinidad Eye Hospital to be able to have a bigger impact. One person could have an impact, but to really have a big impact, you really need a team of people. And you need the team of people working with the same aims, objectives, and aligned in the same way. So the Trinidad Eye Hospital was designed and built to really transform eye care.
And that you have done. You've immediately been the change that you wanted to see, which is certainly inspiring. But let's get specific in terms of World Sight Day and some of the innovations and advancements that you utilize so that we can have better vision as Trinidad. Tell us a little bit as to how you're going to be observing that this time around.
So this year, we're actually going to be doing screening at our 3 offices. So on Wednesday, we'll be screening at the Masca office in San Fernando. Mm-hmm. On Thursday, which is World Sight Day, we'll be doing it in Brentwood in Chaguanas. And on Saturday, we'll be doing it in the Paget office in Tunapuna. So all free screening would be going on in all the offices this year.
Beautiful. Tell us a little bit as to why it's important to take care of our eyesight. A lot of the times we see that people retroactively, when something happened, begin to be concerned. But prevention is better than cure. So tell us why these things are important.
So at all ages, you know, you really need to be thinking about your eyes. And this is obviously kids. Love your eyes, kids.
Right. And
the focus is on the kids. Because sometimes, you know, the kids don't say anything and they're going about and then you see them squinting or something to try and see and then you pick up something might be going on.
Right.
But by that time they've already lost or not done so well in classes and you're not sure why and you're thinking it's because they're not really being disciplined. Mm-hmm. But the truth is they may not be seeing so well. So it's important this time around this year for us to focus on the kids. And to get the kids tested, simple thing, get them to see an ophthalmologist, get them screened for vision testing, if it's available, and get them to see their optometrist. Just get their eyes tested. And they should really be tested once every 2 years because things happening really quickly in the kids. We have this hurricane coming. I think we have a hurricane of short-sightedness happening in the kids. And that hurricane was actually brought on not by climate change, but by COVID-19, which really hit us and made a lot of the kids have to go onto the screens to get educated for that 2 years. And now we have the hybrid going on where a lot of kids still at home, doing a bit at home, sometimes going to school. And there's a lot of home teaching that happening. And because of that, they're not going outside. And that outdoor activity was really, really important at keeping short-sightedness to a minimum. So what we've seen is an epidemic of myopia in the kids. And that is very worrying. We've actually started to develop treatments as a result to try to reduce myopia when we start seeing it now post-COVID-19 in kids. So getting the kids tested now is becoming more and more important.
Right. Tell us a little bit more about those treatments that you help to or seeing developed, just so that we are more comfortable with the notion, since it can be a little intimidating to take your child to an eye doctor and not be able to describe what's happening or what we're looking for. So tell me a little bit about some of those advancements and treatments that we may be able to see at the Trinidad Eye Hospital.
So what we started doing is myopia clinics as a result of the increase. And one of the problems with eyes is if eyes start to develop myopia, they actually start to get a little bit longer, and that's why you need the glasses. So there is a change, pathological change within the eye for that increase in the near activity. And that increase leads the eye to develop other conditions. It could promote retinal detachments, glaucoma, other things in later life. So you really want to reduce that change as much as possible. So they've started to work on using eye drops in the kids to try and reduce the progression of the myopia over time. We have special glasses that we could use now to try and enhance or reduce that growth. So there are lots of changes and innovations being done to reduce myopia progression in kids.
Right. Now, what you're talking about is internationally. In terms of the specifics of Trinidad and Tobago, part of the reason you've earned that medal will be because of the things that you have done within the Trinidad and Tobago landscape. Are there some things that we can look forward to, or perhaps that you're working on currently, that you can share with us this morning?
In terms of the kids, we've started to do a lot of screening in schools. And we thought, because there's a national program by the Ministry of Health for primary schools, that we would not have seen much refractive error or myopia in the secondary schools. So because there was a program in primary schools, we went into secondary schools and started to do screening. So last year we screened about 3,000 kids in secondary schools. And we found the percentage of patients or kids needing glasses was about 20%, which is very high, after they've been screened in the primary schools. But between primary now and secondary, because of the epidemic that's going on, there is a large increase. So there is a need to keep screening, even after you've left primary school.
Oh, for sure. And that reminder is to do your screening every 2 years, is it? For both children and adults, yes?
Yes.
Making sure. I have to book my appointment, so thanks for that reminder. But we're going to continue to hear from you and the Trinidad Eye Hospital, particularly because with the screenings across the country, we will see that we may need follow-ups and those sort of things. So tell me a little bit as to the larger impact, the plans beyond World Sight Day to make sure that we contribute to making sure people's vision is clear.
There's a lot of things we could do. And of course, we screen not only in schools, we go out to communities. So look out for us in the community. When, we're on Facebook, we're on all the platforms. So you'll be able to see when we're coming to your community to do screening, because we have mobile screening as well. So we ramped up from screening between 1,000 to 2,000 to screening 10,000 this year. So we have a whole team that goes out and do that. We're really looking to screen a lot more. And this medal, I think, will help us because we already have corporate TT helping us with our screening of about 10,000 people. We want to try and screen much, much more. And because now, when we go and they open the door already, the medal helps us to open the door a little more. So we're really looking forward to an amazing future to be able to do much, much more for people of Trinidad and Tobago.
I love how you brought that in terms of that medal inspiring you to inspire people to take better care of themselves. Fantastic work that we cannot say thank you enough for, but I'm glad that you're going to continue, particularly with the mobile screening. That means that you may be able to reach places that don't have an actual brick and mortar space,
Right.
so that we perhaps can check for a rollout or a calendar of events, I imagine, throughout the next year, yes?
Yes. So we'll be coming to your region. Look out for us.
And we're bringing the medal, yes? Now, in terms of larger impact, we are the Trinidad Eye Hospital, but we cannot forget the Sister Isle, and we cannot forget even the region. I mean, it's a couple of sailings away. Will we see some sort of growth or development in the near future towards the Sister Isle and beyond?
Yes. So our main outreach program is diabetic eye screening. And the diabetics, they develop bleeding in the eyes and other diseases. So when we come out to screen any community, we don't only screen them for some problem in the eye, but we actually also educate them. Mm-hmm. You know, look at what you're eating. Look at what you're putting in. Because what you're putting in really affects you. And that is something you have control over. Mm-hmm. The genetics you don't. So you have to work on what you have control over. So when we go into the communities, we have pamphlets, leaflets. We work with the people like the Diabetic Association to do outreach. And the Diabetic Association is big in Tobago. So we are always pushed to go to Tobago. And my team love to go to Tobago.
Who doesn't?
Yeah, who doesn't? Because they get us, you know, a fantastic journey out there. And then they really pick up a lot of problems out in the communities in Tobago. Right. And they're able to transform those communities. So we look forward to that. I like that you ask about the region, because we have been able to go regional. And we travel out about 10 times a year to other countries to really help them to develop their eye care. And each one is a little bit different. When we go to Antigua, for instance, we're able to do a lot with the team there, the medical team there, to really develop them. There are doctors there, we do educational sessions, and we also do surgeries when we go there. We take a surgery team. We really, really like collaboration, because through conversations, everything happens. Mm-hmm. And that's one of the things I like about this medal. I think it's going to open the door for us to be able to have conversations. And with those conversations, then we could transform. Mm-hmm. Without those, we can't do much.
Dr. Bhola, we truly appreciate this conversation this morning for raising our awareness as we head into World Sight Day on the 10th of October, but also for letting us know all of the beautiful work of Trinidad Eye Hospital and you yourself as well. Congrats again on that medal for all the doors it has opened and all the eyes it will open. But for now, we hope that all of your celebrations and observances will be successful, and we'll talk to you soon.
Oh,
Thanks for joining us on the Now.
Oh.
Guys, we're going to continue with even more things that you can add to your calendar, that you can be a part of, and you can celebrate with us here on the Now. Stick around. We'll be back.